So it is my great pleasure to introduce Dr. Kate Stern. Kate is Associate Professor of Obstetrics and Gynecology at the University of Melbourne and the Royal Women's Hospital in Melbourne. She's also Head of Endocrine and Metabolic Services and Acting Head of Reproductive Services, also at the Women's Hospital. In addition, she's the Clinical Director and Head of Clinical Research at Melbourne IVF. And Kate has a special interest in medical fertility preservation and has established and coordinates fertility preservation services at both Royal Women's Hospital and Melbourne IVF. So, Kate, welcome. And
Thank you.
tonight I'd like to talk to you about your experiences working with patients who are also seeing natural therapists, and in particular, communicating with them and referrals and what you'd like to know. So I'm gathering that you would get quite a lot of referrals from different types of practitioners. What information's helpful for you when you get letters from these practitioners?
Well, it's been an evolving world, really,
Mm.
in terms of the collaborative relationship. And I just do want to say at the outset, Ruth, that you really opened my eyes to this world of natural therapies. And I do want to thank you. And I think my patients and the patients of my colleagues have very much benefited from that broad, holistic approach. So I just want to get that in there, even though you didn't ask me that. So
Thank you.
I think, I think that it's like any practitioner to practitioner referral. You want to know what the patient's problem is, what sort of insights you've gleaned or gained from your communication from the patient. What's your assessment of their fertility situation, their ovulation, or other things, and really what things have been tried already. What
Mhm.
herbs, whether they're Chinese herbs, naturopathic herbs, that sort of information. It's a little bit difficult sometimes to sort of get a list of things that we don't really understand what the active ingredients are, etc. But I think it's always better to get as much information as possible, and then we can always contact the natural practitioner to ask them what some things are.
Mhm. Okay, and so I'm thinking that the length of time that they've been treated and the outcomes of those treatments would also be helpful.
Oh yes, absolutely. So I guess you know, the we all think that the best way of getting a referral, and we try and do it ourselves, is what the patient's problem is, what the assessment has shown, and what's been tried, and what the response was. So yes, absolutely.
Hmm. And is it helpful for you to get a bit of a sort of bio, really, of the practitioner? Because there's lots of different types of practitioners, I imagine, who are referring to you.
That's right, Ruth. There are, and unfortunately, we're not that. I think you were the first person to explain to me the difference between a homeopath, a naturopath, and a Chinese practitioner. And now it's just a lot more complicated than that. There's all sorts of different psychological practitioners, and it's a complex world that we live in. So, yes, it would be really good to know what sort of treatments have been tried, and what's behind those treatments, and what's that practitioner's area of expertise.
Hmm. Now, you're a very busy practitioner, and I know we developed a method of communicating that was relatively effective where we had the patient as the go-between. So you would say to the patient, uh, can you tell Ruth to do this? And I'd say, can you tell Kate I'm doing that? Is that an effective way, or would you prefer to have those kind of inter those kind of relationships or communications written? How does that work for you?
So, yeah, that's a good question. I think that the essence, though, is to have communication. That's the most important thing. Is that we're working as a team for the patient, and so
Mm,
it's really important. And the days are gone where there was this sort of perhaps disrespect or disregard or competition between different sorts of practitioners. We're all in it together. 70% of our patients are seeing having complementary therapies, whether it's supervised or not. And can I say the worst thing is the patients that are having it unsupervised. That's what really worries me.
Mm.
So I think number one, we need effective communication because we're all in it together. And I think we'll hopefully talk in a minute, perhaps we can talk about the impacts of different therapies at the same and why it's so important to know what's going on. But I think, different practitioners, different natural therapists and different fertility specialists have different ways of communicating. And probably the best thing is to just say, what's the best way to communicate? So yes, in the old days, you and I did that. But actually, Ruth, you will recall that in the end, we just used to text each other and email each other, and we'd sort of have the patient there and sometimes call each other. I personally find email really helpful through my office because
Mm.
my
Yeah.
team can help me, and also then I can document everything in my file for what treatment the patient's having. So I think
Yes.
yes, effective communication, and that might vary from practitioner to practitioner, but written communication is really useful. And sometimes we need to be available for each other fairly promptly.
Yes. Yeah. Exactly. Okay. So, are there sorts of treatments? I mean, you've alluded to this that you like to know about. I mean, there were, for example, I always used to have a policy to stop treatment when a person first started an IVF cycle if they'd already been on herbal treatment. Do you have a preference for that, or um,
Well, yes, as you and I have discussed, we know that products like Vitex slash Premula and Tribulus actually have specific ovarian activity. And so if we're trying even ovulation induction for a patient, you and I used to talk about we'd sort of try one or the other first because we don't know whether a patient's going to over respond. And as you know, there's a risk of multiple pregnancies. So normally, if we were starting conventional medications for ovulation assistance, it would be great to just try one product at a time to to reduce the risk of multiple pregnancy and to know what was actually being effective. And I
mm,
guess it's similar in IVF for a first cycle of stimulation when we're really testing the water to see how a patient responds stimulation wise. We it's ideal not to have more than one product at a time because we need to know what sort of impact that product is having.
mm, exactly, yes. Are there other times, apart from starting a new cycle, where you like patients to stop IVF, herbal treatment when they're doing IVF?
Well, Ruth, one of the things that you and I have really enjoyed working together in is premature ovarian insufficiency. And we've both had lots of patients who have had premature ovarian insufficiency, whether that's just idiopathic, constitutional, or as a result of chemotherapy or other treatments.
Mm,
And for those patients, I have a sort of a plan of different medications that I try. And we try some of my medications and we try some of your medications, but it's actually quite good at the start not to have them at the same time. In the end,
mm,
sometimes we go, throw the book together.
yeah, yeah,
But that sort of treatment, I think, again, we need to be clear. And I guess also for patients we still sometimes do what are called down regulation cycles for IVF when we want to suppress everything before we start some active treatment. And it's completely counterintuitive to have Vitex or Tribulus while you're trying to suppress everything. So there are other situations. And
mm,
then we have the concerns about early pregnancy. Patients are ringing me saying, should I be stopping my herbs? I can't get hold of my naturopath. And you seem to be, you know, more able to answer the phone, Kate. And that's a time when I think it's really important to be able to have good communication and to know what's safe and what's not safe in early pregnancy, because I can't advise patients about what's safe or unsafe.
exactly, yeah. Mm,
And I think that goes also for vitamins, high dose vitamins and minerals, as well as the actual sort of herbal, complementary ovulation medications and early pregnancy medications. I don't know about the safety of medications that are used by other practitioners for early pregnancy. I can't look them up and see a classification.
mm. Yes, I mean, in an ideal world, a patient would only be on things that were safe were they to become pregnant, because after all, that's our aim. So they should be on doses of things that are safe during pregnancy.
Mm.
So, have you ever noticed any side effects? I know there's been some talk about patients on large doses of supplements having more bleeding at OPU. Have you noticed that? That's egg pickup.
Yes, and which products particularly are you thinking of?
Well, I mean, fish oil may be one of the ones
Mm.
that could increase bleeding, but have you noticed that as a side effect yourself?
No, I haven't specifically noticed that, but I do notice, and that might be that sometimes patients don't tell me when they're on things like fish oil.
Mm,
They might tell me if they're on something like Vitex or Tubulus, but they won't tell me if they're on fish oil. But I know that there are some practitioners who actually say to their patients, when you're having procedures, you must not be on fish oil. So I understand that there's an association with fish oil. And I think there were a couple of other things as well, but I haven't specifically noticed it with fish oil.
mm,
Um,
mm.
I think that there's also some concern about St. John's wort. Have
Uh,
you read anything about that?
I think in general, anaesthetists don't like St.
Mm.
John's wort. You know, so, but we tend to use St. John's wort that's got a low hyperforin level. But as a general rule, you wouldn't be using St. John's wort for a fertility treatment unless somebody had concurrent depression or anxiety.
Well, which
But
a lot of
yeah,
them do, yes. And
yeah.
yes,
Yeah, I mean, the safer herb that we use is withania, and I think we've had a number of discussions
yes,
about withania.
yes,
So that can be used, doesn't seem to have any interactions with
no,
any known drugs. So
yeah.
I would tend to use that rather than St. John's wort for a patient intending to get pregnant.
Yeah, I think the fish oil is something that's a good thing to raise because patients don't even consider that as an adjuvant or an additive. It's just
Mm,
something, it's just like
yeah.
taking, you know, one tablet of vitamin C a day. So patients often don't tell us about things like fish oil because it's not sort of considered a naturopathic treatment.
Mm,
And
mm.
that may be why we don't specifically know about those. We can't make the association.
Mm. So going back to where we started, it's helpful for you to get as much information on product and what patients are taking as absolutely possible.
Absolutely, but with the understanding that we cannot interpret for our patients the
What?
value or risks or side effects or safety of many of these, because that's one of the problems, I think, Ruth, isn't it, that, and hopefully it's getting better now. You and I have talked about this with respect to the TGA in the past, a lack of documentation and means that it's often hard for us as conventional medical practitioners to be able to explain the risks and complications of these medications for our patients.
Mm, yeah, exactly. Okay, thank you very much for that, Kate. That's fantastic.